In late 2019, a killer virus broke out worldwide known as COVID-19. This virus has then infected and killed millions of people in all parts of the world. Going on to the year of 2020, many U.S. citizens were feeling the lingering effects of COVID-19. This virus was spreading rapidly, affecting many people, whether it was short to long term. Unfortunately, communities of color were more highly impacted by the long-term effects of the killer virus. Many minority groups work essential jobs due to their disproportionate socioeconomic status. These essential workers are often working in more dangerous and riskier environments, making them more likely to be exposed to COVID-19. Since many minorities are forced to work during these horrible conditions, they are often the ones to contract the virus and die immediately after due to their lack of care. This chart shows the difference between COVID-19 cases and the deaths of African Americans compared to the rest of the population in America. The left side compares the deaths and the right side compares the cases. When the state is light orange, orange, or red, that means more African Americans are being affected compared to the U.S. population. When the state is light gray or gray, that means less African Americans are being affected compared to the rest of the population. As seen on the chart, there are lots of states with higher case and death percentages for African Americans. The African American community is one of the communities that has suffered the most when it comes to COVID-19. African American deaths from COVID-19 are 2 times greater than would be expected based on their share of population. Despite the fact that the Black community only accounts for about 30% of the U.S. population, they make up about 56% of COVID deaths. We can see that African Americans are dying at a 2.4 times greater disproportionate rate because minority groups are more likely to work essential jobs that are in riskier conditions. Working Americans are overrepresented in 33 different states and territories. These communities doubled the population share of COVID-19. This image is similar to the last image, but instead of comparing the impact of COVID-19 on African Americans, it is comparing the impact of the virus on Hispanics and Latinos. The left side compares the deaths, and the data demonstrates that the difference isn't too extreme, because most Latinos getting infected are millennials. On the other hand, the right side compares COVID cases, which the data shows is more than proportional. This means that Hispanics and Latinos are disproportionately being infected by COVID-19 all around the country. The Latinx and Hispanic communities are other minority groups that have felt the struggles of COVID-19. Hispanic and Latino communities make up a greater share of confirming cases than their share of population. Like the African American community mentioned earlier, Latinos are overrepresented in essential jobs which increase their exposure to COVID-19. In about 20 states, there are a greater number of COVID-19 deaths than there is a population share. In this bar graph, it shows the share of population, share of cases, and share of deaths for several ethnicities and races, which include whites, blacks, Hispanics, Asians, and Native Americans. This image shows how white and Asian communities have less infected and death rates compared to their share of the population. It also shows how African Americans, Hispanics, and Native Americans have a higher infected and death rate than their share of population. This means that the people that belong to these ethnicities are more likely to get infected or even die because of COVID. People of color tend to have higher death rates of COVID-19 infections because of the same structural and systemic racism that the United States has placed on these groups. This causes improper access to healthcare facilities and information. Having to work and live in environments with this type of disease may be more prevalent causes for higher rates of infection. Higher risk jobs that lack proper healthcare is one of the reasons that COVID-19 has been able to destroy these communities the way that it has. Even before the spread of COVID-19, these same communities were suffering from chronic diseases such as heart diseases, diabetes, and lung diseases, which all disproportionately affected minority populations. As officials began to look for answers on why COVID-19 cases were rising in minority communities, they quickly realized that the reason why they were being so affected by it was because they come from low-income communities and lacked the resources that they needed to fight off the virus. An example of this was New Orleans. In April of last year, New Orleans realized that their drive-thru strategy was not working as well as they hoped it would. This was because the hotspots for COVID-19 were based in low-income African American communities. A solution to this problem was sending out mobile testing vans into these disadvantaged areas, therefore giving access to people who might not have access previously to these testing sites. Focusing on the disparities that low-income communities as well as minority communities face is important for helping them protect and defend themselves. A more specific example of a community that has also been struck by COVID-19 is Boyle Heights, a predominantly Latinx low-income community in Los Angeles. As a community that's made up of essential workers, Boyle Heights became one of the most infected areas in not only California but the entire United States. As of today, Boyle Heights holds second place in COVID-19 cases in Los Angeles at 14,763 cases. Jobs became limited and many completely lost their jobs, leaving them without any income to pay for food, medications, and rent. Many people pushed for rent forgiveness, but unfortunately that never happened. Due to the financial crisis that this neighborhood was going through, local businesses such as restaurants severely struggled to stay open. Many permanently closed because they couldn't afford to pay rent and their workers as well as for other expenses. One of the things that need to be done in order to help these communities that are being destroyed by COVID-19 is to suspend rules and laws that prevent undocumented immigrants from accessing proper care that they need to keep themselves and the rest of the population healthy and protected. Many U.S. citizens are against providing testing and vaccine access to illegal immigrants because they argue that they are receiving benefits from the government, even though they aren't citizens. This isn't a political or economic matter, though. This is a humanitarian crisis where thousands of people are dying daily. By providing testing and vaccine access to everyone who is currently living in this country, we will decrease the infection rate in hopes of also decreasing the death rate. This is something that will benefit the whole country. Providing temporary housing in order to keep individuals from infecting their families when living in small crowded housing is also extremely necessary. Providing basic needs such as food and wage support is also a way to help out impacted communities. COVID-19 is something that affects all of us, so we need to work together as a country and help those that are most affected by this deadly disease.